So welcome. This is episode 6 of Let's Fix the NHS. And I'm here with the media star and irrepressible nurse, Poppy Bazell. Poppy has gone live 2 years ago on Instagram and had an incredible success talking about her experiences in nursing and talking about her passionate beliefs that well-being from a spiritual, physical, mental space is so important to be able to care for others. Poppy, really great to see you. Thank you for our discussion yesterday, which I enjoyed so much. And I'm looking forward to getting into it today and learning more about your background, your philosophy. We've got a question of, if you were the president of the Royal College of Nursing, what would you do? So many things to get into. So, thanks for joining me today.
Thank you so much. Thank you for inviting me onto the podcast. I loved our conversation yesterday. And I just want to say it's a pleasure speaking to someone who is actively trying to do something to help the NHS. I think a lot of us, we're very guilty of moaning and complaining and picking fault at what is wrong with the NHS. But it's people like us with innovative ideas that need to have a voice. So any opportunity for me to have a platform to speak on, I'm going to take it. So thank you for having me.
Well, hopefully as the platform increases and we bring it to fruition, you'll have a much bigger role because you've got an amazing voice. You care deeply. We talked yesterday about my motivations for starting this, and thank you for the thanks, by the way. The reality is I want to create a legacy for my mother and my brother and my father and other family members, to give back, to say thank you for incredible care that my family have received. But it just became really evident that people at the front line, they're the ones with the solutions. They're the ones who face problems on a daily basis. And they're the ones often who don't have the voice. So the fact that you recognize that is amazing. You've got a voice yourself. You've been, is it 25,000 people following you on Instagram? And the reaction, I think, to your social media side has been incredible. Maybe we'd start, rather than going back to the beginning, let's just start on that for the moment.
Yeah, sure. It's been a massive journey. I mean, before I opened my Instagram account, I'd come off of social media for 2 years. So I had no social media. And that was all during my own healing journey. I just needed to come away from everything, go off grid and just put all of my energy into my healing journey and understanding, what I wanted out of life. So I came back on 2 years ago and started Mindfulness. I had no idea what I was doing. My sister kept saying, you need to make a reel. I said, what on earth is a reel? So it's been a huge journey as a content creator, but actually I really enjoy making content. It's really quite fun. So I actually make content while I'm on duty at work. So I do 12-hour shifts at the hospital. And while I'm on my breaks, I try and find 10 or 15 minutes to just film a little bit of content. And really the inspiration behind what I'm putting out comes from working on the shop floor in the heart of the NHS and seeing the struggles that we're going through. Wellbeing is my absolute passion. And I feel so strongly that we need to change this culture of self-sacrifice. It's all about healing the healers. So for us to be the best nurses, carers that we can be, we need to prioritize our health and wellbeing. So my social media, I do a lot. I talk about some of the main issues that we're seeing in nursing. And I think that the best thing, to support people on starting their healing journey is to educate them with, why am I actually feeling this way? So I've been talking about moral injury. I've been talking about burnout. And actually what I've created is this amazing community. I've got not just nurses, I've got doctors, I've got paramedics, midwives, you name it. I call us the multidisciplinary team because we're all in there. My message is applicable to anyone in medicine. We've created this community where it's a safe space. People don't feel so alone in how they're feeling. Because as nurses, we're very good at just sucking it up and getting on with our jobs and not talking about how we're truly feeling. So when I talk about the pain that we're going through from having to deliver care that is inadequate, that resonates on such a big level. So it's really bringing people together. And I think that's the biggest impact that it's having.
And would you say you've got a profile of audience? Who would be a typical, someone who engaged, not maybe I'm sure many people watch passively, but those that watch and really relate to your content, who do you think?
It's mainly nurses and midwives, I would say.
Right. And is it people who are senior, people who've been in the job a long time, or is it people who are newly qualified or going through the training or looking at getting into the
It
profession?
really is an array of all sorts of people. So I've got student nurses who have not yet entered the profession who message me. I've got Band 8 matrons who message me. And that's the beautiful thing about Wellbeing. You know, I did my first nurse Wellbeing retreat a couple of weeks ago. And when we're in the hospital, you know, you've got your Band 5 nurses, you've got your Band 6 managers, you've got your Band 8 matrons. We've got all this hierarchy. When you strip that away, underneath it, we are all just human beings who are all there to care for our patients, and we are all fighting the same fight. We're all feeling the same struggles. So I have an array of different people of all different experiences and backgrounds, but they're all telling me the same thing, that they are really struggling in the profession. And unfortunately, we are losing thousands and thousands of nurses.
Yeah, I mean, that when you look at the future, that is pretty scary, isn't it? And when you think of the reasons people leave, what are the reasons people leave? I mean, in your research, in your experience, what do people tell you, and what would it take for them to stay?
Thank you. So the NMC did do an annual leavers survey. So I think during 2024 to 2025, we lost 26,000 nurses. The number one reason is retirement. So naturally, nurses are coming up to that age where they are leaving the profession. But also, we're now seeing people who are leaving because of the toxic culture of working in the NHS. People are leaving because of physical and mental health problems. Burnout is pushing people away. But the biggest thing I think is, and this is what I'm seeing and hearing, is, you know, as a profession, we feel very unseen, unheard, and unvalidated for the amount of work that we are actually doing. Because nurses, I believe, you know, nurses and healthcare assistants, amazing. We are the backbone of the NHS. And, you know, while this system is sort of failing around us, who is trying to hold that system together? It is the workforce on the shop floor. Who is looking after the workforce? No one. And we're all suffering in silence. So that's why, you know, my message of well-being is so important.
And go back to the leaving. An awful lot of people continue in the role, and they continue while they're struggling so much. Their life can fall apart, but they're still going into work. They're still going in and caring.
Yeah.
And like you said, it shouldn't be a self-sacrifice. It should be something that builds people up. We know it's difficult, and I think the healthcare assistants are the angels of the system, because they do the really dirty work, don't they? And but you know, when you take those and the nurses, which work together, work in teams, it's so important that people can feel like they're making a contribution. Pay is important, but it's not the only reason people go into work. But what I'm interested in is the reasons that people hate their role. And often it's the little things, isn't it? And yesterday we were talking about the difference between amazing managers and people who are not amazing. And that can make a difference, can't it? So maybe we talk through that, the sort of spectrum of those who go in and are happy because they're feeling like the system's working for them, and the opposite.
Yeah, absolutely. And, you know, so I do bank nursing, so I'm not assigned to a specific ward. I go all over the entire hospital, and I see what works well on some wards, and I see what doesn't work so well. And there are some really, really incredible managers out there who are doing such amazing work. Those managers, I believe, they lead by example, so they're not afraid to get stuck in and get their hands dirty. We like to work under a manager who's not just sat down in the office all day. We like them to come out and be with the staff and get their hands dirty. But also they're thinking about the well-being of their staff. We're working under such limitations at the moment, whether it's chronic short staffing, you know, whatever, but there's small things that managers can be doing to make their team feel seen, heard, and validated. So there is some amazing work that is happening. But then also as well, we can't ignore the fact that there is a very toxic culture within the NHS. And you asked me about people who hate their jobs. some of the nurses in my community are incessantly bullied by other nurses. So, although it's an incredible profession and nurses love doing what they do. That is why we went into it. We're such caring people, but the environment that we're working in has become so challenging that it is really hard to enjoy your work.
What do you think is in the mind of the bully?
I've done some research to try and understand what causes someone to become a bully. And ultimately, someone who bullies another person is actually expressing a deep unhappiness within themselves. Because when you are in your healed energy, when you are someone who is comfortable in who you are, you never tear down other people, you only simply lift them up. So someone who is bullying someone else has got a deep inner pain. Often they've come from trauma themselves. So maybe they were treated badly as a child, maybe it's a behavior that they've learned, but in truth is a wound. It is a wounded person who is projecting their pain onto someone else, often someone quite vulnerable, to make them feel better about themselves. So that's why I tell my community, because often if you've been bullied, you start to believe that there's something wrong with you. Is highly traumatic. So, by understanding actually you were never the problem, they were the problem, it helps us just understand that dynamic a little bit better.
For the first few years of my life, I worked in hotels and restaurants, and as a part-time waiter, and I worked in different roles. But one of the things that chefs are pretty well renowned for is being quite direct, I think is the understatement. And there's a fine line between who's a bully and who is under pressure in a service period, being very demanding because there's urgency and there's real outcomes. It's not the same as life and death in a hospital or a health environment. But it certainly felt like it back in the time. It really did. I'm leading into the question is can people be perceived as bullying when actually they're just trying to get stuff done quickly and efficiently, and someone who is perhaps a little bit more sensitive, maybe, not always, could perceive a non-bullying behavior as being bullying? Is that
I think so. I think, it's completely dependent on the situation. When you're in this kind of profession, you're going to find people from all sorts of backgrounds and all sorts of different walks of life. And, the fact we work with people from other countries who often do have a very different communication style, it's just kind of having that understanding. So how are they communicating? So I guess it comes back as well to having a level of sort of self-awareness. And because, like you say, similar to when you were working in the restaurants, we are in a high-pressured environment. So you will see people behave in all sorts of different sort of situations, because if you've got an emergency, you're under a lot of pressure, people will shout. So to some degree, that's where our resilience comes in. To some degree, we do have to have a level of self-awareness, a level of understanding, and a level of resilience. But at the baseline of it all, we are all there together for the patients. And, I think bullying should just not be tolerated at all.
Yeah. I don't get me wrong. I agree. Yeah. But again, it's that sort of process to be, people can clash, the personality clashes all the time. And like you say, it's really important to take it back down to that base principle of we're here for the patients. Yeah. And what can I do to make your work experience better and our collective effort better? And people need that curiosity and desire to ask that question.
Yeah, no, you're absolutely right. And, I think that was a huge shift for me, was realizing that if someone says something to you, you have a choice in how you respond. So if someone makes a snarky comment in the profession, we get it all the time. We have a choice to dwell on that. How dare they speak to me like that? I'm here doing my job. Or we can simply choose to think that person's probably having a really bad day. One really good example I'll give you of that is we deal with a lot of angry patients and angry relatives, naturally. So one of the biggest things I learned was anger is a secondary emotion. So there's usually something underlying. And normally in this environment, it's anxiety or fear
Yeah, yeah.
So, often I see nurses dealing with angry relatives or patients and they're getting their back up, they're getting really angry. I didn't come here to get shouted at. How dare you shout at me in front of my staff? I actually quite like dealing with angry relatives because I know that there is always something underlying. So the best thing is to take them away from the situation and just say, I hear you, I hear what you're saying, and they will soften, and then you'll find out actually what's really going on. They're terrified that their parent's going to die, or so it's kind of having that self-awareness, maybe a little bit of emotional intelligence as well.
You're reminding me of a kind of reverse situation where mum was, for anyone who watches you, is watching you, my mum had a stroke and she passed away 15 months later after a month after a second stroke. And she was in hospital for the first 4 months, a month in the Royal Stoke in the acute ward and then 3 months in rehab. And she had aphasia, so she couldn't communicate. I'm not going to go into all the detail, but probably about 6 months, 8 weeks before she died, she had a seizure. She'd had 2 or 3 in the latter few months of her life. And she was admitted because her blood pressure was very low. I'd given her the seizure medication, midazolam. And anyway, the paramedics, to be safe, admitted her. And regrettably, it was in super hot time of the year, and it was an old ward where she was admitted, a geriatric ward actually in the Royal Stoke. And it was just a difficult few days. Anyway, she came out, we got the medication adjusted right, but while we were there, it was a 4-bed bay, and this member of staff was there. One of the patients had dementia and was sundowning quite regularly, going a little bit. How would you define sundowning?
Sundowning is a phenomenon that we don't quite understand in dementia patients, where when the sun goes down, their behaviour starts to exacerbate. So I don't know if it's something to do with the circadian rhythm, but often they start to present with quite challenging behaviours.
Yeah, it's kind of like a werewolf coming out of nowhere.
It is, yeah.
That old film. But so it can be people lack inhibitions. They can be quite vocal, quite rude. Anyway, this one patient was pretty rude continually to this member of staff, I think she was a healthcare assistant. She wasn't a nurse. This woman just couldn't take it. She really couldn't take it. And she blew up back at the 80-something-year-old lady who was saying, "You're terrible at your job," and all of this kind of thing. And it made me think, actually, it must be very difficult to handle, but there's ways of handling it. But to get angry with someone is just not acceptable. It's just...
No. And thank you so much for sharing that. That's a really good example. And this goes back to why, as healthcare practitioners, it is so vital that we prioritise our health and well-being, because if we're going through struggles at home, if we are emotionally vulnerable, if we aren't quite well in ourselves, that will tip us over the edge, because it's really negative energy. And of course, we've shown up to just do our job, and we've got patients, obviously, with dementia. It's negative energy being blasted at us. And if we are vulnerable because we're not prioritising our health and well-being, then we will respond like that. And it's quite interesting, actually, because I worked on a dementia unit the other week, and I had a very, very similar situation. This woman, oh my goodness, she was being absolutely just awful to me. She was dousing me with her water bottle, thinking it was petrol, telling me she was going to set me on fire, telling me to effing go and jump off of a train, wanted to kill me. Like, it was so aggressive. And I could really feel the aggressiveness of the energy, and I thought, this is awful. But I just smiled, because smile releases oxytocin, our bonding chemical. I just smiled, and I just said to her, "Oh, cleanse me of my sins." So you have to have a little bit of a sense of humour, I think, sometimes, to get through some of these situations. It is so challenging, and you must have seen that.
And you've also got to be aware of the people around you as well, because there's family members there. There are sometimes, not always, but other families for other patients. And if you get angry, then it just it sends everyone in the wrong direction. And whereas you have to be careful how humorous or how flippant you can be, because frankly, you've got to also be respectful, despite what you're facing. In that moment, I was quite surprised. I didn't say anything, but perhaps I should. That comes to the training. And again, what we talked about, the skill of the manager really to be monitoring and being acutely sensitive to that mood change in people. Yeah. And if they're noticing someone's walking with a scowl, is it because they've just had a battering from an unruly patient? I also remember this is terrible. It's absolutely the worst situation. So Mum was at the Haywood Hospital, which is in a place called Tunstall. It's a community hospital. It's probably 20, maybe, I'm not sure whether there's 10 or 15 wards within that hospital, but and it was a hospital I was born at. But there was a patient. Mum was in the stroke ward. It's called the Sneed ward. And there was a patient, a gentleman in a wheelchair with one leg, mid-50s, incredibly strong. He clearly had his, he clearly lost his leg quite some time previously, but he'd got some form of brain injury. It wasn't a stroke as far as I understood it. And on 5 or 6 occasions, I saw this guy threaten to kill security guards, getting vocal, really vocal and angry because they wouldn't let him out for whatever reason. He wanted to be home or he wanted to be somewhere else, but he couldn't. So 1 minute, he really was a Jekyll and Hyde. He could be nice. He could actually be there in the corridor. He would wheel himself around the corridor and people would walk past him and it would be fine. And then this one day, and several of the times when he was vocal and I was there with Mum and I'd wheel her around in the wheelchair, we got locked in the day room because he was on one and really getting quite angry. And then there's one time a patient walked in. There was a patient, I won't say their nationality, but they were a ethnic minority who'd had a serious stroke. This was the father, lovely gentleman. The mother and the daughter would come and visit, and I sometimes would say hello. And on the way in, we were walking into the hospital down the corridor together and chatting. The daughter's probably 16, the mother's mid-40s, something like that. And we walk in, and at the end, when you're through the doors for the ward, Mum's bay was to the left and their father and husband was to the right, so they went. And the next thing, before I'm really even in the Mum's bay, the girl is shouting, running down the corridor, saying, I need help. Is there a staff available? And I actually suggested that a lady called Grace, the healthcare assistant, could go and help them. And then actually she went up, and then I realized actually I needed to go as well. Yeah. And this guy had basically hit the patient who was nonverbal, who was suffering from a stroke. While he was in his wheelchair, it hit him. The wife, quite a small lady, had stepped in between, and the patient had hit this lady on her arm a couple of times. I mean, this is a big, strong man, even though he had just one leg. And by the time I got there, the healthcare assistant, Grace, who I'd asked to go up to help them, he'd got her pinned into the middle of the room, in the corner of the room, and he was about to assault her. And I managed to grab the back of the wheelchair and pull this guy into the center of the room, and the table went flying and the drinks went flying. And anyway, the situation was managed, and then the security came. There must have been at least 5 or 6 instances of this. And amazingly, this lovely family didn't want to press charges. They were just, she was badly bruised, this lady. This man shouldn't have been there. And these staff shouldn't have been, and patients should not have been party to this. They shouldn't have been exposed to it. No. And in a way, it's the failure of the system, because I was told that there wasn't anywhere for this man to go to. The mental health facilities and other facilities just didn't either have any spare capacity, and therefore we were put there.
Yeah.
What are your just sort of thoughts and
Yeah,
reactions
I
to
mean,
that
it
point?
sounds like an absolute nightmare scenario. Unfortunately, it's not, it's not a rare sort of thing to see in the hospitals. And unfortunately, we are seeing a huge rise in staff being attacked and abused by patients. And again, like you say, it comes back to, the failings of the system. We've got huge issues with mental health, bad mental health in this country, and the mental health facilities just aren't there. So what we're seeing at the moment is more sort of mental health patients on the acute medical wards who shouldn't be there. And let's not forget, nurses don't have any mental health training at all. We get no mental health training. So we're dealing with patients who shouldn't be there, who are a risk to themselves, to the patients, and to the staff. So it's becoming an increasing problem. And unfortunately, it's just becoming kind of like the norm now to go on. I had a colleague the other day who got punched in the face, and bless him, he had a black eye, and he'd come back to work the next night. And really, it's not a nice experience to be attacked in your workplace. But again, it's just something that we're seeing more and more of.
Incredible. Let's go back to the beginning.
Okay, let's go back to the start.
So where were you born, brought up? Family, siblings? I mean, what's your
full background?
How did you get into this?
So I'm from Devon in the southwest of England. I'm from a very big family, one of 7 siblings. I've always been extremely caring. I've cared for so many members of my family, and nursing just seemed like a really natural route for me. I got my first job at 18 in healthcare. I was doing caring in the community. And I remember the first day I put the tunic on and I walked into this lady's house and I said, "Morning." And I caught sight of myself in the mirror with this tunic on. And I thought, oh my gosh, you really suit this. Like, you really suit this job. So I started off with a caring background. I soon went into nursing because it just seemed like the natural progression. And I absolutely loved it. So I qualified in 2014. So it'll be 11 years this year. I went straight into accident and emergency, fell in love with emergency life-saving medicine, just thought it was amazing. At a young age, really loved working under pressure.
Sorry, let me ask, what did your family think of what you were doing?
I don't really know. I think they were quite proud of me going off. I'm the first nurse in the family. I think they were quite proud for me to go off to university and, be the first nurse in the family. So yeah, I got my degree. I started my nursing career. But I knew very early on that I didn't want to progress up the sort of traditional nursing ladder. Most people have aspirations to become a manager or a specialist nurse. I knew I just wanted to have a good quality of life. So from quite an early on point in my nursing career, I joined the hospital bank, which meant that I could have full control over my schedule. I could pick up the shifts when I wanted, which meant I could travel the world. So I've done a lot of traveling. I'm a huge adventurer, explorer. So I did 3 months in Southeast Asia. I've traveled Central America, and my job enabled me to do that. I could work for 6 months doing night shifts in A&E, and then I could book a block off of 3 months and just go traveling. So for me, it was absolutely incredible.
Did your qualifications allow you to work elsewhere, or did you not do that?
No, it was just pure adventure time. Yeah, so I would work really hard and then take that time off. In 2019, I moved over to the Caribbean and I worked out there as a practice nurse for 3 years, which was an amazing experience. So I was there during the pandemic, living in paradise, having a great time. And then eventually I moved back 2022 to this country and I went back to the bank.
Why the Caribbean?
My gran was living out in the Caribbean. So my gran lived out in the Cayman Islands. So I was out there looking after her and nursing.
And that was her end of life care, wasn't it?
Yeah.
Or did you know it was going to be?
No,
or?
not at all. Not at all. She fell ill in 2020. So when kind of the pandemic was all kicking off, she found a lump in her groin, and because of the pandemic, everything got super delayed. So she waited months for like biopsies and a diagnosis. And by the time she got her diagnosis, she had an aggressive stage 4. It was quite a rare neuroendocrine cancer. So She only had 6 months from when she was diagnosed to when she passed away. And we went through this really intimate cancer journey, where I was for the first time supporting her as a relative on the receiving end of healthcare. And it was really, really hard. It was, as because you went through it with your own mum, it's really, really hard supporting someone through such a challenging diagnosis. And then I was with her as she went through the sort of end stage dying process as well. And it just really, my grief after she died took me to a really, really dark place. I really struggled with her loss. And very similar to you with your mum, she's one of the main reasons that I started out on this whole journey. And, she's always here reminding me of why I'm trying to do this work. She did so much humanitarian work. And she was a huge part of the Cayman Islands. I mean, they had a minute's silence for her when she died in Parliament. And she's still winning awards now, even after she's passed, for the amazing charitable work that she's done. So when she died, I was speaking at her funeral and there was all of these people at her funeral. The whole island essentially was mourning for this woman. And I just thought, wow, like what an amazing impact to have. And I kept feeling like, I feel like I need to do something. What am I doing with my life? I started to really look at the way I was living my life and I started to ask myself quite big philosophical questions. What sort of impact do I want to leave when I'm gone? How do I want to be remembered? How can I follow in her footsteps and make such a huge impact? And at the time, I was 29 years old. I was living my best life, partying, drinking so much alcohol. So I've been through a huge sobriety journey as well. And to be honest, I was just getting drunk every weekend.
Right. And I mean, you explain your nan. What was her name?
I knew her as Miss Pat, Granny Pat.
Granny Pat. But it sounds like Granny Pat had an amazing, a life well lived.
Absolutely.
If she was giving such a lot to other people, that's incredible. What took her to the Cayman?
She was a very successful businesswoman in the 70s. So she was successful back when women weren't really in business. She had her own computing company, moved to Texas. So she lived in Texas. And I think she just fell in love with the Cayman Islands. I mean, it is a paradise.
And wow. And then, so you worked in healthcare in the Cayman Islands. And so what exactly did you do? What kind of clinic was it for?
So I was working as a practice nurse in a private GP clinic. It was all private healthcare. Honestly, it's so different from the NHS. I worked for a really small team. There was 15 of us. Cayman Islands is a overseas British territory, but it's a tax haven. So my salary as a nurse was 75% higher, tax-free. And I was working for this private company who would take us out for brunches and private events. And so I was really quite well looked after. The quality of life was amazing. The job itself was quite boring for me because I'd come from like a quite emergency acute background. And here I was kind of like a glorified medical secretary. But I really enjoyed it. It was a great quality of life and it was a great experience to see private healthcare as well.
But in the Cayman particularly, I mean, I know, although it's a very wealthy place, there is poverty as well, isn't there?
Absolutely.
And I guess the healthcare needs of those in that environment are not as well looked after as those who compare.
Yeah,
right?
It's quite sad, the inequality on the island because, it brings in so much money. There's a lot of wealth there. There's a lot of rich expats. And then you'll go to another side of the island where there are literally people living in huts with no electricity, no water. There's a huge divide there. So I didn't actually see so much of that because the government hospitals, if someone was underprivileged, they would receive care from sort of the government facilities.
Oh, they would they?
Yeah,
Okay.
so I was in a private GP clinic, so I was seeing people of that there.
Then the pandemic happened.
It did.
Just talk me through that because I think there's a lot of injustices that occurred on so many levels in that time. And from what you've explained to me already, that you were on the wrong end of one of those injustices. Do you want to just touch on it? We don't have to dwell on it, but it's good to kind of bring it into the broader background.
Yeah, no, of course. I mean, it was a really crazy time. Cayman instead of flattening the curve, just stomped on it. They locked the whole island down. And we essentially lived on this paradise island for like 2 years, COVID-free. So it was a strange time to be a nurse, really, because we were seeing what was going on in the outside world, but nothing really happening in the Cayman Islands, which was amazing for the people. But then, yes, the whole course of action of my life changed with the rollout of the vaccines. So, like I explained yesterday, when they first came out, for me, it felt a little bit rushed. So I thought I would do my due diligence and just take my time and research, what the risk and benefit of me taking it would be. And I did my research. There were a couple of red flags for me. So I hesitated. I was vaccine hesitant, but I was able to buy some time because we had no COVID on the island. So there was no real pressure for me to get vaccinated with there being no COVID. But things started to change, and it's a small island. There was over 90% vaccination rate. There were certain things that were put into place. We can't open up the island to tourism until everyone's vaccinated. There's a lot of pressure. So there was a lot of pressure on me to take the vaccine, and I didn't want to take it. It was my choice, my informed choice based on my research. And it was really just simple for me. The risk of taking it for me outweighed the benefit. Really, for me, very simple decision. But I didn't know that would change the entire course of my life, because I got fired from my job for making that choice quite brutally, quite abruptly. My work permit got cancelled and I basically had to leave the island. 6 months before, gone through this huge grief and loss with my gran, still trying to navigate the grief and the pain through that. And then I get hit with this huge loss again. I've lost this, not just my job, but this dream life that I have created. I'm living this amazing existence in the Paradise Island. And overnight that was just all taken. So December 2021, I found mid-December back in the UK after 3 years in the Caribbean, back in my family home. And just my life was completely turned upside down.
In the middle of the pandemic as well?
Well, we were still in the midst of it, because we were, end of 2021 I came back.
Amazing. And you had COVID, didn't you, at some point? When did you say?
Yeah, I had COVID.
So, so the journey back into nursing here, you had to navigate that, didn't you?
Yeah. So after being fired from my job overseas, I came back to the UK and I didn't know if I would be able to continue in my career as a nurse if I didn't take the vaccination. So I got in contact with my old hospital and I started going through the process of coming back onto the bank. And all the while, I'm absolutely terrified that they're going to ask me for my proof of vaccination. And I managed to get through the whole interview process and she hadn't mentioned it. And I was thinking, oh my God. And then right at the end, she's on the phone. She said, oh my God, I nearly totally forgot. Where are we up to with your vaccinations? And I just said, I'm not vaccinated. Luckily, I'd had COVID the month before and I'd had a blood test to check that I had antibodies. So I had proof that I had natural immunity. So I was able to use that proof to get myself back into the NHS. They did, however, say that I'd have to leave in April because they were threatening to mandate it for all NHS workers. But of course that was revoked. So I managed to keep my job. But as you can imagine, all of that trauma that I went through, it really opened up my eyes to what do I actually want to do? I was so disposable, just fired on the spot for bodily autonomy, which was when you're fired from a job, it's often because you've done something wrong. And I hadn't done anything wrong. And that really, it was so painful. It hurt so much. So I had to start out my healing journey because I was so traumatized. When I got back to this country, I was a shell of a person. I'd gone through that huge bereavement with my gran. I'd gone through being fired from my job and now trying to navigate what am I doing with my life. So I started out on my healing journey and I was led directly down the path of holistic healing. I discovered all these really beautiful modalities that I'd never experienced before.
So did you read books? Did you go on courses? Did you talk to people? I mean, how did you?
I started off by taking time for me. So I started really focusing on my health and well-being and my self-care. I started really looking after myself. And then I started going to things like sound healing. I started meditating. I started going for Reiki energy healing. So I was really going down more of a sort of healing route. And I just had I received so much benefit from these practices and I had such a huge transformation. I went through this kind of huge awakening process and I started to discover areas of health that I didn't know about. So here I am 9 years as a registered nurse and I'm only just learning about the connection between the mind, body, and the soul. I'm learning all about spirituality and spiritual well-being. I'm learning about emotional health and mental health. And I started to realize, wow, like, as nurses, we don't understand truly how to be well and how to be whole. So after such a hugely transformative healing journey, I knew that I had to find a way to share it with the world. And with my position being so uncertain as a registered nurse, I started working towards creating my own role so that I had something to fall back on, something where I could never be fired ever again, something that was truly mine and something that really aligned with my values and beliefs. The Mindfulness was born in 2023. I retrained as a spiritual counsellor, a health and wellbeing coach, and a Reiki energy healer. And I started doing healing work alongside sort of my job in the hospital.
So if we go to just dig into the Reiki, spiritual healing, energy, sound,
Yes.
how do you tailor it to an individual?
Yes.
And what is mindfulness? Is it courses? Is it one-on-one? Is it just explain what the business model is as well?
When I started off in 2023 I called myself a holistic nurse practitioner. I wasn't actually offering any sort of nursing duties. I was just blending my background in nursing with my holistic healing work. And I was working with clients with chronic and long-term health conditions. We are looking at the full picture. So in the NHS, we're looking solely at symptom management. Well, as you know, of your mum who went through stroke, when you work with anyone who's gone through a life-changing diagnosis, that has an impact on them on an emotional level, on a mental level, and on a spiritual level. So I would have clients come to me for Reiki energy healing, which is a beautiful complementary therapy. But I would also do one-to-one online coaching with clients from an array of backgrounds. I've worked with people with mental health problems, people with breast cancer, and we were looking at everything. So stress management, diet and lifestyle, relationships, trauma, all of these things that make up who we are. We started peeling back the layers, and the work that I was doing was really incredible. But after about a year of trying to establish what mindfulness was and who I was helping, I started to look around at the profession and I started to see nurses completely drowning in burnout. And I just had this light bulb moment and I'm like, I need to help nurses. So in March this year, I changed and registered my company as a limited company. So I've completely changed the direction of my work now. And so at the moment, Mindfulness Limited, it's a holistic wellbeing company which supports the wellbeing of nurses. So we are challenging this outdated belief that we need to self-sacrifice to be good nurses. It's about educating nurses to start taking back control of their own health and well-being. And I've been doing it in a manner of different ways. I did my first nurse wellbeing retreat a couple of weeks ago.
Yeah, you said about that. Just talk us through that.
It was just magical. It was so amazing. So I found a retreat space, which I rented for the day, and I had 7 incredible nurses. Some of them had travelled from Hampshire, Bristol to Devon to come for the retreat. And I just put on the most beautiful day, and we had meditation, we had a yoga class, we had a sound healing gong bath, we did a self-love workshop where we wrote letters to our future selves, which I'm going to post to them at the end of the year. But it was just really magical. We had a chef come from London to do the lunch, but the most powerful thing about it all was creating that community. I'd brought all of these nurses together. Most of them didn't know each other, but they connected on such a deep energetic level because we understand what we're all going through. So, at the beginning when we did the sharing circle, people were talking about what they're going through with their job and burnout. And it resonates so deeply for all of us because we know, we work together, we work in the system. So it was just amazing. Everyone left feeling so incredible. And we've all got a little WhatsApp group now, so we're keeping in touch. It's just really great.
It sounds amazing. Can we go back to what I said before about, some of the concepts, maybe they are a little scary for some people, or it sounds like it's about belief systems, and those belief systems vary widely.
Yes.
So how do you approach that? Because you've got to be very careful not to. It should be universal, shouldn't it? It should be that everyone can avail themselves of these services that take them from where they are to where they want to be. They want to be happier in themselves. They want to managing the stresses of daily life, and particularly a very stressful job, more effectively, so it doesn't detract from who they are as people. And for it to be universal, or maybe it's not universal, but if it is to be universal, in a way, you've got to attract, not repel.
Yes.
And some things that have spiritual or religious connotations or question marks can seem like they're non-inclusive. So just a question.
Yeah, no, absolutely. And I think at the start, you know, I felt like I was in a very privileged position as a registered nurse. You know, I'm a respected medical professional. I come from a scientific background. I was very picky on the modalities that I chose. So Reiki is probably a little bit on the fence, but it has a scientific background. You know, it has a science base. There's research to suggest that Reiki does actually work. And, you know, we're starting to see a lot more energy healing in the NHS, especially in oncology, having a look at conventional, having a look at alternative. If you want to use that essential oil because it makes you feel good, great. You know, it's just very, very difficult because a lot of these alternative therapies, they haven't got a large evidence base. So for us as medical practitioners, we have to be very careful about what we can recommend. So that is why I've stuck with my counselling, my coaching, and my Reiki energy healing.
Because it's interesting. I mean, I did years ago, well, I've done it twice, a fire walk with Anthony Robbins, where you walk over 20, 30 foot of incredibly hot coals. And it's, I think if you pause and take a look at your watch and decide, then maybe you would burn, but the walking across in a heightened state is quite an amazing experience. And what it proved to me was the body and the mind together are incredible, really, when they're properly channeled. Now, I don't think you can get firewalks on the NHS, but the reality is there's so many things that are out there that people use, and I guess we've got to be open-minded, but equally we've got to be careful. There's lots of charlatans and others that would hypnotize you, and hypnosis can be good for stopping smoking. I mean, there's so many tools and technologies, so it's good to hear that you've got a measured approach to that.
Yeah.
And I'm excited about you delivering this business, because I think the need for it is massive. And if I can help you, and if this platform can help you, absolutely we will. I think it's important to give people that release, and that essentially a pressure release valve, isn't it?
Yeah, absolutely.
But it's more than that. It's kind of like a reset, isn't it? So like you said, you went through that healing journey when you came back. And I can only imagine the stress that you went through. You're on a personal level, but then the professional level, and changing country. I mean, that's an awful lot. That's a big reset. So you mentioned alcohol before, and you've also mentioned that you've had quite a period without a drink. So could you mention that a bit?
Yeah, of course. So I started my sobriety journey. I was 29 years old, so my gosh, it's coming up to 4 years now. The fact that I've lost track is good because it means I'm not so obsessive over it. You know, when I first gave up drinking, I'd started to use alcohol very much as a crutch. You know, I was going through a lot of deep emotional pain, and I had no tools in my toolbox to deal with this level of suffering that I was going through. Historically, I'd always reached for a drink in social situations, you know, happy, sad. I'd always used alcohol, and I'd always been a very heavy sort of social binge drinker, but it just completely spiraled out of control towards the end of 29, before I'm about to turn 30. And it came to a head. It got to a crisis point where I was faced with a situation. You either continue on this path and let the pain of your trauma completely destroy you, or you stop and you make a change. So I decided to stop drinking for my 30th birthday as a huge gift to myself as I stepped into a new era of my life. And I didn't know that I was going to give up permanently. I thought, I'd just do 6 months, see how it goes. But the benefits of going sober were so deeply transformative for me. And, in the time I'd gone sober, I'd finished my master's degree, I'd started my own business. My life was really on this trajectory, like really, really happy. So yeah, that's where we've stayed. I don't drink. And now, of course, I'm pregnant, so definitely not drinking.
Congratulations.
But that in itself has just been a huge journey and a huge eye-opener, because I think alcohol, it's so easily accessible, it's so socially normalized. And I think a lot of us do use it as a crutch to deal with our inner pain.
And how do you feel in yourself? I mean, did you feel you've got more energy, more alertness?
Just so...
Think straighter?
I didn't realise I always thought I was quite healthy. I didn't realise how ill the alcohol was making me until I gave up. So it did get quite bad, and I've always been very open and honest with this, but before I gave up drinking, I had a bit of a tremor. I'd started to lose my eyesight. And after the first 10 days of going sober, it was like someone had lifted a veil from my eyes, and all of a sudden I could see clearly and I could think clearly, because towards the end, before I gave up drinking, I could barely string a sentence together. Like I was just not here, just not here. So after sort of the first 10 days, which was a really hard time going sober, I started to see and think clearly, and I just started to be really present in my body. But of course, if you've been someone who's used alcohol your entire life to suppress all of your emotions, when you go sober, they come in big time, because all of a sudden you are allowing them, all of them to be felt. So, but that's the biggest secret to the healing journey. A lot of people don't realize this, but we spend our whole life running away from our pain through all means of, whether it's drinking, forms of escapism, gambling, whatever. The cornerstone to the healing journey is allowing ourselves to actually feel that pain. So the journey has been pretty heavy going and really quite scary, because I didn't know in truth who I would be without a drink in my hand. But my life since I've given up drinking has just been incredible. It's the best decision I've ever made.
And did you have a support network, or some people go to AA or other groups, and or some people have a best friend or a counsellor?
Yeah.
Or who was there for you?
So I did a lot of therapy. So I did counselling, and I did a lot of shadow work. So that was trying to understand the reason behind why I was actually abusing alcohol as a drug. I did a lot of personal deep healing work with it. And also I educated myself. So I started reading a lot of books. I started listening to podcasts of people who'd gone through their own sobriety journeys. And I started really understanding the impacts that alcohol was having on the physical body. And once I'd learned that how toxic it is, it's listed as a grade 1 carcinogen, so high risk of causing cancer in humans. Once I realised just how bad it was, I was able to change my perception of it as a drug. So rather than looking at a gin and tonic and thinking, oh, I'd love to have a gin and tonic, I would look at it and think, why would I put that poison in my body? So it was a huge mindset shift to overcome it, because if you're trying to go sober with willpower alone, at some point you will buckle.
And so what you're explaining is a reframe.
Yeah,
classic.
Exactly that.
Again, I think I read this in Tony Robbins a long, long time ago, that you're essentially changing the meaning. You're rewiring your brain. So when you see X, it means
Absolutely.
Y. The gin and tonic doesn't mean happiness, refreshment, whatever. It means I'm taking arsenic. It's something equivalent. And therefore that sends totally different signals, which is, I'm guessing, a process that you probably use elsewhere in your work. Yes. Whether it's a group or an individual session, or I believe you want to create a lot of educational content So it's more accessible to larger numbers, but specific to nursing, which I think is a really exciting idea.
It is really exciting. And I feel like since I've honed down on who I'm helping, things have just unfolded. And honestly, it's so needed. But I've got so many ideas to share. You know, I've got lived experience. I work in the NHS. I see what is going on. And I've got so many exciting ideas to share. And they're actually helping. I'm making a big impact with the work that I'm doing. So it's really amazing to see the impact that I'm having on nurses. And I was explaining to you yesterday about the ripple effect. So for us to make this huge change, when we go into our jobs, we have, if we're able to make these changes, if we're able to prioritise our health and well-being, we can show up to our job as our best self. And that has such a positive impact, not just on patients, but on staff, on our colleagues. So this idea behind mindfulness, which is shifting from self-sacrifice to prioritising us, healing the healer, it benefits everyone. And for me, going back to on a systemic level, it is so simple. If you put time, effort into the workforce, if you support their well-being, the whole system benefits.
And I think I mentioned Dr. Natarajan, the head of the Ward 127, the stroke ward. He attended a integrated stroke delivery network, ISDN it's called, part of NHS England. I attended an event that they did for the sort of broad stroke network, and there was some amazing discussions in that, but and presentations. But Dr. Natarajan said at one point he did an exercise for all of the staff in the ward, all the nurses, all the healthcare assistants, cleaners, everybody, to know their numbers, so to do their blood pressures multiple times. And remarkably, very few people did know their BPs, and often it was out of a normal range. So it's really interesting if you look at the health of that workforce and really widen it to the health of the country, which is why one of the ideas around Let's Fix the NHS is we need to have a healthy country to have a healthy NHS, a healthy economy. Yeah. We need to have a healthy workforce for that healthy economy, and for people to live their best lives. Now, we know it's not always possible, that we know there's so many things that affect us, but an awful lot is self-inflicted. An awful lot is not just self-inflicted, but a result of multiple stresses that we don't manage or can't manage. So ideally, we reduce those burdens. You know, we fix the NHS by reducing the burden upon it. And successive governments actually have wanted to do 3 shifts. So, or they term it 3 shifts, but essentially going from analog to digital delivery where possible. And AI is now coming in to potentially make a big difference in some areas, from cure to prevention, and from treatment in acute and secondary care and hospitals to treatment in where possible the community. So those 3 shifts they've always been there really, but what I believe Let's Fix the NHS can do is help actually model the successes and help people replicate them, understand why this personal journey is so important, and people managing their own health reduces the burden on the NHS. Very simple. If you're not significantly overweight, your chance of having a hip replacement or needing one is lower, or an ankle operation. I mean, all of these things are really, really important. But I believe the solutions are within the people like yourself. You've got a solution that if we roll it out and help you, that can enable those carers to be better able to care for others and themselves at the same time. So I talked about the idea and I sent you a little bit of material. What do you think of the idea? What's your view?
I think Let's Fix the NHS. I love it. I think anyone who is trying to make positive change, I've got a lot of admiration. I think that there's a lot of passion behind the company. And, Steve, yesterday you really kindly went through your experience with your journey with your mum, that really intimate journey of being on the receiving end of stroke treatment in the NHS. So, you've got a really good understanding of what's happening within the system. And so your passion behind this project is so powerful. And I do believe that you will have a big impact. Some of the things that I particularly like is the fact that you're giving a platform back to the people. And I think something that I've realised is how disempowered we feel at the moment as healthcare workers to have our voice heard and to talk about, positive changes that we would like to see. And like you said, ultimately, we are the ones who are working inside the system. We see the cracks, we see what would work better. So thank you again for giving me the platform to speak, but also you're doing other really important work with other healthcare practitioners. You're hearing from people from all disciplines of medicine. The other thing that I love is that you're going to try and focus on supporting the well-being of the workforce to increase patient outcomes. And I think that is so paramount. I'd love to see in the future a national health service that really promotes well-being amongst its staff. I think it's just going to have such a hugely impactful benefits, not just for the individuals, but for the patient outcomes, which you discuss in your business, but also for staff retention. If people are happy in their job roles, we're going to see less staff leaving.
And that's the thing. It comes down to the ideas are there in those personnel. And one of the things I believe passionately, and thank you for the kind comments, by the way, I really, really do appreciate. And the vision really is to bring people together and to create this sort of combined crowd power. We'll be crowdsourcing ideas and incentivizing them, giving people, whether it's meals or we might say we'll hire you to deliver a retreat, and that can be a prize that we offer for people who engage on the platform. So that's the kind of thing that we want to do, is gamify and make the whole process fun and enjoyable. In the sort of manifesto, we say it's about saving, improving lives, giving frontline workers a voice and empowering them. We want to do it profitably because profitably will enable it to scale. Yeah. The other part of it is about having fun and enjoying the experience. And experiences, actually, like your retreat the other day, experiences just bring people together and enable them to breathe and to think. And when you're doing that reset, sometimes those experiences just give people that enough time away to decide to make that change that is perhaps necessary. I've had a lot of feedback because this idea it was literally, my mum passed away in August last year, and she was, after a second stroke, she was there for a month, which I've recounted in a video. I'm putting little pieces of it up every day, although I've missed a couple of days, so I need to catch up. But and I'll be putting the full hour-and-a-half video, and there's some video of Mum and other people who were part of that journey. But I was there 2.5 weeks of her life. She was very heavily sedated, and that gave me time to think and to talk to people. And I remember talking to many of the nurses, and one particular nurse, JJ, a male nurse, who was telling me about how they didn't, like 2 or 3 of the computers in the ward wouldn't work and hadn't worked for 6 months. And yet he's like a computer hobbyist and wizard, and they wouldn't let him touch them to repair them. And it's like just silly things like that. He must go in every day seething, thinking, and then they've got to find a computer and log on, which is often complex and takes too long. So a 5-minute task can take minutes. Yeah. And it's this kind of thing that if that happens, mistakes and problems happen. But if you can have a system where we can create the pressure on these leaders and on government leaders and NHS leaders to change things like that, and we can do that collectively, ultimately, then JJ and his colleagues will go in and think, I'm seeing momentum, I'm seeing forward momentum. And Poppy, what do you think the difference between hope and hopelessness is, in your view?
That's a really good question. I think we have to find hope. We have to find things to give us meaning, to help us find motivation and inspiration. I think it's a mindset. I really think it's a mindset. We can find little glimmers of hope in life, whether it's a sun rising in the morning, whether it's a butterfly going past you. We can find small pieces of beauty in everyday life. But unfortunately, sometimes when we are feeling lost, when we are stuck in this kind of like negative mindset, we do feel extremely hopeless. And I think that is why Let's Fix the NHS is very powerful, but also the work that I'm doing with Mindfulness is very powerful, because it is giving those people who feel hopeless a glimmer of hope. Actually, maybe there is another way. Actually, maybe there is a better way. And going back to what you said about community, if you can get on a mass scale, the community feeling this hope and this motivation, this inspiration, that's when you start to see real change happening. So I think, the idea, I think it's just wonderful.
Thank you very much. And I like your definition. I would frame it this way. And I think hope is when you can see evidence that your actions or those working in support of you and on your behalf are going to create a better tomorrow.
Amazing.
In some way. Hopelessness is the opposite. Hopelessness is where no matter what you do or others do, nothing's going to change.
Yeah.
And it's almost like an evidence base. It's not a static state. It's a trajectory. So if things are slightly getting better, or JJ sees the computer being fixed and other things being responded to, and I use that term, it's probably not a politically correct term, but really, really crazy stuff continually happening and not being changed, and just endless bureaucracy for bureaucracy's sake with no explanation. When you see all of that, it just becomes soul-destroying, and it becomes difficult because it gets in the way of doing what one is going to do.
Yes, exactly that.
It's that trajectory of change. If you can see it, then you have hope. If you can't, then you don't.
That's it. And what you said about, soul-destroying, I feel this so strongly, that the soul of our profession, there are a lot of people who are feeling hopeless, and that's why we are seeing so many staff leaving the profession. So anything that we can do to just remind healthcare workers of just how wonderful they truly are, to recognize the incredible work that they are doing. And that's why my platform is so important, because I love on a daily basis to just remind people of how important they are, how amazing the work is that they're doing, the impact that they're having as well.
You said you get feedback. Talk about some of the feedback that you've had, some of the comments, and you're making a difference. And I've seen it clearly because you've got people who actively engage. But any particular stories that stand out that you want to?
I get a lot of feedback from my community. So, you've only got to look at any of the posts that I make and look at the comments section. People are sharing their personal experiences from sort of working inside the NHS, the struggles that they are going through. But people reach out to me on a personal level as well, in confidence, to talk about often the things that they are going through. It's really raised my awareness on how awful the sort of bullying culture is. I knew that bullying was an issue within nursing, but I didn't quite know the extent of how bad it is. Some of the things that people share with me are just like horrific. You would never expect to see that kind of behaviour in a caring profession. So I'm learning so much from my followers. I'm learning so much because I work in quite a small hospital. The hospital that I work in is great. It's really small. Everyone knows everyone. It's a very friendly place. We have our struggles. We have our challenges. But in some of these bigger city hospitals, they're having real issues. So I have learned a great deal from my community. And there is a underlying theme amongst all of the messages that I get through. And it's just despair that nurses, they can't do the job that they want to do. They're falling out of love with the job. They've got such a caring, kind heart, and they couldn't imagine doing anything else other than nursing, but they just feel so conflicted with what to do.
Do you find any, though, that are the opposite, that are still in love with the profession, or find ways to be in love with it?
I think
still?
There's definitely a few. Like, I've definitely seen some really positive nurse Instagram pages, community nurses who love their job, and it's really nice to see. And I try to not always be so negative with the content that I'm putting out, because obviously I am raising awareness on lots of the deep-rooted issues. But also I do share the joy that I have with my own personal work, because the truth is I love being a nurse. Even despite the constraints of the system, I really love doing my job. And I've been able to fall back in love with nursing, because I nearly walked away those 4 years ago. I've been able to fall back in love with my role because I've made this huge switch. I've stopped sacrificing myself for the system, and I've put myself as the top priority. My health and well-being comes first. And as long as I look after myself, I can continue turning up to my job, being the best nurse that I can be, and really enjoying it.
I'm going to make you either the president of the Royal College of Nursing or Wes Streeting, the Health and Social Care Minister. You can choose only for the day.
Only for the day.
So you've got to create all the changes in one day. No, you can have as long as you like, but what would you do to change it?
I mean, there are just like layers and layers and layers of things that we could be doing, but from a wellbeing perspective, I would love the RCN to take me on for the day as a wellbeing consultant. And what I would love to see is wellbeing being pushed out across the profession, not just for nurses, for healthcare staff, for everyone, to make wellbeing a top priority in order for us to make this huge change. Because you have to remember, a lot of nurses who've been in the profession for a long time, they've been conditioned now to self-sacrifice. You know, it's really hard to start prioritizing yourself when you've always worked that way. So I would absolutely love to see wellbeing programs being rolled out to university students who are training to become nurses. So at the very, very start of their careers, you know, they learn all about burnout and prevention. They learn about setting boundaries and leaving work at the door. They learn about nervous system regulation and how to manage their stress. All of these things that we're not taught as nurses, you know, the basic fundamentals of health and well-being, diet and nutrition. So in the dream world, let's say 5 years down the line, I would love to just see a massive switch up in this culture so that we can start to see an increase in patient outcomes. We can start to see people falling back in love with their job because they're feeling so good going into work. And you know, we've got less people leaving the profession.
Can you see technology playing a part? So I've the Apple Watch I've got, which was Mum's actually, it tells me to stand up every hour or so. I mean, that's a very, very simple example of a wearable that can have some sort of impact. Do you think there's ways that the technology can make a difference for mindfulness? I mean, you're talking about perhaps writing or creating an app at some point, but those kind of reminders or triggers, the things that if we're not taking time out to think, to meditate. Now, some people kind of poo-poo apps, and there's just another product, just another something that's trying to steal time. But any ideas, any thoughts?
No, I think technology absolutely does have a place. And I know a lot of nurses are using apps to help them with meditation and mindfulness on their breaks. You know, we are seeing more wellbeing in hospitals. We have wellbeing boards in our staff rooms. But I think also as a sort of culture shift, reminding each other, like when I'm at work, I love to remind my colleagues, have you drank enough water? Like small little reminders that we can say, supporting each other to take our break, you know, because that's a huge thing at the moment. People aren't taking their breaks. So supporting each other and covering each other, you know, please go for your break, I'll cover you. Supporting each other and coming back as a community is huge. But
And you talked yesterday about food availability, and the choices are pretty limited for healthy.
They're awful.
Nutrition.
They're awful. You would think going into a place of health that you would find some sort of healthy nutrition, but the food choices in hospitals are so poor, not just for the patients, but also for the staff. So, you know, being prepared when you go into work with your healthy lunches, because on the days when I forget to take food or I've not been organised, I have to go to the canteen and the food is not healthy. There's nothing really healthy there's no healthy options at all, really. So, you know, we had a little discussion yesterday about, and today again, about the health of our workforce. You know, we are at the forefront of healthcare. Should we be leading by example? I mean, it is in our nursing code that we have a professional duty to be of a fit state in health and well-being to perform our jobs. But making it more accessible is a good place to start, providing healthy food in the canteens.
Yeah, and the smoking huts, we talked about that yesterday. It always baffles me that those open spaces and outside spaces, you know, it's always something to behold when you see people sitting there in a wheelchair puffing on a fag outside in their dressing gown, or even worse, all the healthcare staff huddled up under the smoking cabins. But that's something we won't tackle today in its entirety. Well, this has been amazing. It's I'm really excited about you and your business and getting to know you. I think the potential of what you're doing to create a meaningful life for yourself, for your family, and your newborn in the coming months. I think that's really exciting. You're leading by example, and you've tackled your own challenges, faced them head on, gone through a tough time, a hard time, very, very clearly with your nan and the crazy situation with your work and having to change country. And you've turned that tragedy and challenge into something very positive, which is commendable. I think the potential of that business to help fix the NHS is significant. And I, for one, really look forward to partnering with you, because I can see many areas where we can collaborate. And if any of your viewers are watching this discussion, it's really about creating community and creating change. That's it.
Absolutely.
So,
thank you,
Poppy. Any final words from you?
I just want to say thank you again, and thank you for those really kind words. You know, when we spoke yesterday, I see a lot of similarities with your story and mine. And again, it's about taking that pain and putting it into something purposeful. So thank you so much for having me on. I would like to finish by just saying, if there's any healthcare workers who are working in the NHS listening to this podcast, please, please, please look after yourselves. Honestly, it's no secret that we are working under some of the most challenging times in the NHS. The service is under complete and utter strain. We are holding the system up. We're doing a great job, but we are doing it at the expense of our own health. So please, if you take anything away from this conversation, please let it be that you start taking some time for you start prioritising your own health and well-being needs, and you recognise that you are as deserving as the same care that you give to your patients, because we are all truly such wonderful human beings. We have been let down, but change is coming. So this is a great conversation. Thank you so much.
Bobby, where can people find you? What's the best way, the website and your Instagram?
So my website is www.mindfulness.co.uk. On Instagram, you'll find me. I'm very active. It's Mindfulness UK. I'm also on Facebook and TikTok as Mindfulness UK, but I'm not so good with those platforms. I'm trying to learn them all at the moment.
Yeah, you and me both. Great. Well, I'll put those links up, and we'll post onto all of those platforms. Yeah. There's some shorts. This will go onto YouTube, but it will also go in short form elsewhere. So, Poppy, thank you. We're going to do an awful lot of content as this project comes to fruition, and hopefully we'll have you on plenty of panel and the events that we run. The idea is to run quite a few events where we'll bring people together for these discussions in a more relaxed, conducive atmosphere, not necessarily with a drink, but with something healthy. So I'm looking forward to that. But again, Poppy, thank you very, very much. And I look forward to the next time.
Thank you. Thanks, Steve.